Welcome to the MRCS Bites session on pancreas. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. Overview of structure. Exocrine and endocrine gland. Retroperitoneal organ crosses transpyloric plane, divided into head, body, and tail. Head lies within concavity of duodenum and pancreatic duct drains. Into second part. Tail lies in the lienorenal ligament and contacts the hilum of the spleen. It can be damaged in a splenectomy, leading to fistula formation. Relations. Posteriorly, right to left. Common bile duct, portal vein, splenic vein, IVC, aorta, superior mesenteric artery origin, left psoas muscle, left kidney and adrenal, hilum of spleen. Anteriorly, transverse colon, transverse mesocolon, lesser sac, stomach. Development and anomalies. The pancreas forms by the fusion of dorsal and ventral pancreatic buds. Both arise from the gut tube on day 26 at the level of the duodenum. The ventral pancreatic bud migrates posteriorly around the duodenum and fuses with the dorsal bud. It becomes the uncinate process. Occasionally, there are two ventral buds, and if these migrate in opposite directions, anteriorly and posteriorly, this results in an annular pancreas. The duct systems of the two buds becoming interconnected when the buds fuse. The ventral pancreatic duct usually becomes the main pancreatic duct, and the dorsal duct involutes. If the dorsal duct persists, it is called the accessory duct of Santorini, and it empties into the duodenum at a duodenal papilla. For more MRCS Part B resources, please visit mrcsbites.com.